I think sometimes too, our colleagues don't understand what we do as interventional pain management physicians or pain management physicians, because they'll think, oh, you're just a pain guys, you just write for meds. I mean, they don't know the level of invasiveness of the things that we do. And I always, want to sit down with the refer, not just call them up or text them, but sit down and have an open discussion about what we can provide. When the mild procedure came along, we would ask I'd ask my neurosurgeon, so what do you do for ligamentum flavum hypertrophy? They said, oh, we just do a little laminotomy, we take out some of the ligaments. So I started referring them patients, and then we refer them back to me and say, no surgical indications. It's like, well, bro, don't tell me what you can do and then not do it. I think as long as we can show safety and efficacy, have a cordial discussion with the other doctors, like you were saying about they refer to you, you refer to them.